Good morning and good afternoon, wherever you are. I'm really so happy to moderate this great session with Dr. Arwa Awais. Your Royal Highness, Princess Mona Hussein, Excellencies, Dr. Tedros, Dr. Mandari, Mrs. Annette Kennedy, Lord Nigel, Dr. Barbara Stilwell, and everybody, our great nursing leaders and speakers, and all nurses and nursing students of the region and all over the world who are joining us now. Welcome to the AMR celebration of the end of the Nursing Now campaign. Traveling around the world from east to west through the 6 WHO regions, we are meeting today to celebrate the achievements of the Nursing Now campaign, to thank nurses for their role during the COVID-19 pandemic and reflect on their heroic stories of positive change to move forward. Today, we are bringing all nursing partners together to discuss the way forward to keep our promises of raising the status of nursing and to answer the global plea to make better investment in nursing and midwifery in our region and the world during the 2021 Year of the Health and Care Workers and beyond. Over to you, Arwa.
With a bold and renewed leader figure, Her Royal Highness Princess Mona Al Hussein. She's a WHO patron for nursing and midwifery and the awardee of the WHO Director General's Health Leader Awards for outstanding leadership in global health on her dedication and service to health and humanity and her tireless support over 6 decades for nurses and midwives. The princess who has insisted to celebrate your heroic journey by going live today with you all and for all of you. Your Royal Highness, the floor is yours.
Thank you, Arwa. Your Excellency, Dr. Tedros, Director General of the World Health Organization, Your Excellency, Dr. Ahmed Mandahari, the WHO Regional Director for the Eastern Mediterranean, Lord Nigel Crisp, Professor Sheila Thao, Barbara Stilwell, President Annette Kennedy of the ICN, and Dr. Elizabeth Aero, Chief Nursing Officer at the WHO, and Nursing Now board members. Thank you all very much for the great efforts, which are highly appreciated and valued. Ladies and gentlemen, I'm truly honored to address this audience at this important event of the WHO Eastern Mediterranean region to celebrate the end of the Nursing Now campaign, which is traveling today around the world. And what a journey it has been since November 2018 up to this moment. As WO patron for the nursing and midwifery in the EMRO region, I am pleased that I have witnessed and shared the journey with the Nursing Now campaign and its partners, the WHO and the ICN, from its launching to its end. It has been a unique global journey with nurses and their strategic partners that has witnessed many achievements and challenges, many sorrows, and many victories for all healthcare providers, as well as the citizens of the world. Ladies and gentlemen, reflecting on the statement of Dr. Tedros, the Director General of the World Health Organization, the COVID pandemic is a long way from being over. We have many reasons for optimism. Allow me here to emphasize on a more crucial reason for optimism to end the pandemic, which is the dedication of the health workers, including nurses and midwives worldwide. Nurses and midwives have been highly involved and very instrumental at all stages of response to the COVID-19. Likewise, nursing organizations and institutions in this and other regions of the WHO have played a leadership and advocacy role, calling on governments to quickly contain the pandemic and advocating for supplies of PPE and safe staffing levels. My heartfelt gratitude and appreciation goes to all those who are on the front line of the COVID-19 pandemic. I have noted in my address at the WHO 73rd World Health Assembly, while we applaud the work and sacrifices of these everyday heroes, applause without action is no longer acceptable. Ladies and gentlemen, I urge governments and all stakeholders in the health sector and non-health sector to collaborate and push for harder and wiser investment in nursing education, jobs and leaderships, as the challenge and costs of the pandemic are rising regionally and worldwide, placing a heavy economic social burden on health systems and populations globally. Let us keep in mind the alarming evidence from the call for action to strengthen nursing in the EMRO region and the State of the World Nursing Report regarding the shortages of nurses and midwives, which continue to be one of the major challenges facing the health systems around the world. Dear nurses and midwives, your celebration today promises a successful gathering and a productive deliberation to build on the legacy of Nursing Now and to sustain the momentum during the year of the health and care worker. Now go, explore, and reflect on the experience and the campaign and share the strategic actions needed to optimize and invest in nursing and midwifery workforce while proposing and offering innovative solutions to the current and the emerging health issues to fight and curb the ruthless and invisible enemy, the COVID-19 pandemic. Since the launching of the Nursing Now campaign and the beginning of the COVID-19 pandemic until this moment, always remember, you have grown stronger, braver, more resilient, more competent, and more dignified. I assure you of my sincere and continuous personal commitment to supporting and advancing nursing and midwifery at all levels. Remember, you have been and will always be my heroes. Thank you.
Thank you very much, Your Highness, for such a powerful and inspirational message. You always pave the way for a new era in which all healthcare providers, especially the nurses and midwives, are enabled and included in the re-engineering of health care to ensure that all people everywhere have the chance to live and enjoy the healthiest possible life. Over to you. No. Um, Now we're really honored also to introduce another great leader for nursing, whose nursing and midwifery is high on his agenda, and he takes every opportunity to urge countries to seriously invest in them as assets for stronger and more resilient health system. Please also, all of you, join me to welcome His Excellency Dr. Ahmed Al-Mandari, WHO Regional Director of the Eastern Mediterranean region. Dr. Ahmed, the floor is yours.
Thank you very much, Arwa, for the introduction. It is my great pleasure and honor to be with you in this important event. Your Royal Highness, Princess Mirna Al Hussein, Your Excellencies, esteemed guests, nurses and midwives, students, welcome to this celebration marking the end of the Nursing Now campaign in the Eastern Mediterranean region. I am pleased to take this opportunity to express my strong and continued support for our frontline health workers, the nurses and midwives, who are dear to my heart and high on my agenda. And here I must add that I have been working with them during my clinical work before joining WHO, and I have learned a lot from them. I have seen how much selfless efforts they have really taken, spending day and nights in saving lives, promoting the health of the people at different conditions, different situations, in a very challenging, sometimes risky situations here in the region. When I joined WHO, seeing them in front lines. Colleagues, nurses and midwives are the foundation of the multidisciplinary health team that we need to make our vision of health for all by all a reality. We have all witnessed the heroic role of nurses and midwives in COVID-19 response efforts and in rolling out vaccination around the world. They deserve our full support. However, we still need more well-prepared nurses and midwives to effectively address communicable and non-communicable diseases and promote healthy life, particularly for women, children, and adolescents. A skilled health workforce is essential to create resilient health systems and achieve universal health coverage and the Sustainable Development Goals. WHO recognized that globally by making 2020 the year of the nurse and midwife and 2021 the year of health and care workers. And in 2019, the WHO Regional Committee for the Eastern Mediterranean region adopted a landmark resolution calling for action to accelerate efforts to improve the production, employment, and retention of nurses and midwives to strengthen health systems. WHO continues to support efforts to take forward the agenda of nurses and nursing and midwifery in our region. The Nursing Now campaign has helped to raise the profile of the nursing profession. We advocate further efforts to ensure that nurses and midwives are respected and enjoy a conducive working environment and a more prosperous future. Together, we can encourage nursing leaders to advance policies and inform national action to achieve the Sustainable Development Goals by 2030. Colleagues, I am delighted that today we will hear how young nurses and midwives are making the world a healthier place. Nurses need to tell. You need to tell your story so that the world can learn more about how you taught or how you touch people's lives every day. We count on your leadership, commitment, and engagement to transform health services for the better. In closing, let me thank each and every nurse and midwife for everything they are doing to keep us all safe and well. Enjoy this event, be proud of your achievement, and take good care of yourself. Thank you very much. Back to you.
Thank you, Dr. Ahmad, for highlighting the importance of cultivating the potentials of the nursing and midwifery leaders to achieve health for all by all. Now, over to you, Dr. Ruwaida.
Hello again. It's my great pleasure to introduce the president of the International Council of the International Council of Nurses, my dear friend, President Annette Kennedy, a key globally recognized nursing leader who has chosen the team together all through her career, which has continued to be a central and very central to her ethos and set the tone for her outstanding ICN presidency. President Annette Kennedy has played a great role in guiding the ICN strategy for investing in nursing to their full potential and amplifying nursing voices at the highest level of policy and decision making. My dear friend, President Annette Kennedy, the floor is yours.
Thank you, Ruwaida. Your Royal Highness Princess Mirna, Dr. Hamid, Dr. Tedros, who may be with us somewhere, Lord Crisp, Elizabeth Ero, honourable guests and our Nursing Now board, friends and colleagues all over the world, good morning, good afternoon and good evening wherever you are. I bring greetings from the International Council of Nurses and the 27 million nurses worldwide that we represent. Today I have mixed feelings as we celebrate the end of the Nursing Now campaign. I'm proud to see what Nursing Now has achieved in the 3 years and sad to see it finish. Alongside WHO, ICN has been a proud partner of the most successful campaign the world has ever seen. Nursing Now has energised the profession and brought encouragement and visibility to the nurses at a time when we need it most. It changed public perception and demonstrated clearly to political leaders that nursing is the solution to affordable, accessible and high quality healthcare. But we have a long road to travel to convince them. It is a profession the world simply cannot afford not to invest in. Collectively, we, ICN, WHO, and all the nurses around the world, and all the patrons and friends we have made, will carry on the legacy of Nursing Now with pride, through leadership, working groups, and political influence. The collaborative efforts of Nursing Now with WHO and ICN has already proved very successful. Our chief nurse, Elizabeth Ero, was appointed, but of course, we need chief nurses in every region, and we need chief nurses in every country. But we will continue that fight. Nurses Together, which was a collaborative effort between all of the organisations, collaborated on the WHO State of the World's Nursing Report, and finally on the WHO's Global Strategic Direction for Nursing and Midwifery, which we anticipate will be adopted at the World Health Assembly this week. This has been a great achievement. Over the past year, all our efforts has been on supporting nurses through the pandemic, both individually and collectively. The story of the Nursing Now campaign, Agents for Change, is a wonderful testimony to Nursing Now achievements and their legacy. ICN is delighted to take forward the nursing groups, many of whom are linked to our National Nurses Associations. And Susan Williams has led most of this research with Nursing Now. And we know that they will work with us on the strategy for nursing and midwifery going forward. It will only be through nurses working together to create different models of care to meet the needs of society that equitable healthcare will be achieved. Too many nurses have died, thousands of nurses, unnecessary. It must never happen again. We know that about 80% of nurses are suffering mental health issues, depression, burnout, and post-related violence. We estimate that up to 13 million nurses will be needed in the next few years to bridge the shortage gap if we are to continue to have a health service in the world. ICN is urging governments not just to adopt this WHO global strategy for nursing and midwifery, but to implement it as a priority. Nurses should never again be expected to nurse patients with a deadly virus without appropriate protection and support, and governments have a duty of care to their nurses. Right now, we have 60 nurses attending the World Health Assembly virtually, continuing the political campaign that has been started. But they need to see action from governments, not words. We too must build on the visibility nurses have achieved with the Nursing Now campaign. We must be part and parcel of every policy-making decision. We have to be central to every strategy and task force. We have to be equal partners in health policy decision-making and not just the implementers of policy. We owe it to the nurses who died to seize this opportunity to create opportunities to make our voices heard. The future is in our hands. I wish to thank Nigel Crisp, who has been a very good friend over the last 3 or 4 years, and I met him first in Geneva Airport before we had our first meeting with Dr. Tedros. And we have been friends and colleagues since that. And when I asked him, why did you do this? And he said, well, I was chair of the all-party parliamentary group, And he said, I didn't see anybody else taking it forward, so it was up to me. So on behalf of all the nurses, Lord Chris, I wish to thank you for actually starting this campaign and taking it forward. We will continue the legacy. And thank you to all my friends and colleagues, and thank you to the nurses around the world who are here and who have worked today, yesterday and tomorrow, and will continue the work. We will support you, and we will support you after this pandemic is over, and it will be over. Thank you.
It's my great pleasure now to introduce Lord Nigel Crisp. Lord Nigel Crisp is the co-chair of Nursing Now campaign board. He is a global champion and he co-chairs, like Annette said, the all-party parliamentary group on global health. He is the hero who has kicked off the flashing light of Nursing Now campaign worldwide with nurses and for nurses, advocating for more prominent voices of nurses and midwives in health policy and decision-making. My dear friend, a great mentor, whom I am so proud and honored to work with him for the last maybe 4 years. Your Excellency, Lord Nigel, the floor is yours.
Thank you very much indeed, Rowena. Your Royal Highness, Princess Mirna of Jordan, it is wonderful to join you and Dr. Alwa and Dr. Ahmed, and also my good friends, Professor Rowena Almeida and Annette Kennedy, both of whom have been very strong board members of Nursing Now globally, as you will imagine from what they've already said. And it's great to be welcoming people to this final conference in this great campaign on behalf of my co-chair, Sheila Clow, and myself. May I just take a moment, Your Royal Highness, to thank you personally for your wonderful opening speech just now, which I think captured so many vital points, but also just to recognise what an extraordinary champion you have been for nursing for, I think, over 30 years. This campaign's only been going for 3, so we admire your persistence and your constant championing of this vital cause. Now, I'd like to congratulate and thank nurses for everything they've done during the campaign, even during this dreadful year and a half of pandemic that has taken such a toll. And I too pay tribute to nurses and health workers everywhere for your magnificent work during the pandemic. And it mustn't be forgotten, and we all owe you a great deal. Now, I say thank you for what you've done in the campaign, but also for what you will do. The campaign is over, and we have helped bring people together and build a platform for change. We were trying to make a step change from which things could move forward, but the work continues. There is much more to do before we all get to where we really want to be. There is a legacy there. There is the ICN, a strengthened ICN, I think, taking things forward and linking with Nursing Now groups, which is wonderful to see. WHO has got the new strategic directions for nursing and midwifery, and it's wonderful to hear a regional director talking about the importance of nursing. The Nightingale Challenge, our development programme for young nurses that involved 32,000 nurses so far, is turning into the Nursing Now Challenge, which will last for at least the next 2 years, and I hope beyond that. And perhaps even more importantly, there are many Nursing Now groups nationally that are going to continue, because what matters is not what happens globally, but what happens in your country, in your town, in your village, in your clinic. That's where it really counts. And we set up this campaign because we believe that one of the biggest things we can do to improve health globally is to empower nurses, to raise your profile and status, and enable you to work to your full potential. And I believe that even more strongly now. And I believe there will be increasing opportunities for development over the next few years. Change is happening. And our report, which has already been mentioned, Agents of Change, I hope people will get it off the website, shows nurses as great agents of change in all parts of the world. And when we look back, I think in 5 or 10 years' time, we will see just how far we have come. But let me leave you with one final word about the future. Our health as individuals, our health, our family's health, our patients' health, our health as individuals is intimately linked to the health of our communities and the health of our society, and ultimately with the health of the planet. And it's an idea, I believe, that should guide us for the future as we carry on this great work. So once more, congratulations and thank you for everything you have done and will do in the future.
Lord Nigel, for your inspirational and remarkable speech, actually. And also for all your great efforts and your outstanding presidency with Dr. Sheila Tlaub for the board of the Nursing Now campaign, as well as for the team that you are working with at the Nursing Now, every single person, Barbara and Catherine, Hannah and others. Also working with the Nursing Now groups all over the world. Thank you so much. Arwa, the floor is yours.
Thank you, Ruwaida. Thank you, all everyone. At the end of this session, I really would like to extend our deep appreciation for the exceptional speakers and exceptional, inspiring messages that encourages and reinforces the commitment to continue saving the world by supporting and investing and strengthening nurses and midwives around the globe. Thank you all very much. And with this, the floor is yours, Ruwaida, to introduce Dr. Tadros.
Thank you, Arwa. Let us now welcome His Excellency, the WHO General Director, Dr. Tedros Adhanom, who is a great leader and outstanding supporter for nursing and midwives, as well as the Nursing Now campaign. Very strong supporter. Dr. Tedros will deliver his speech through the following video message. I think now they are fixing the video, I think, message.
Excellencies,
So,
dear colleagues and friends and nurses around the world. Over the past 3 years, Nursing Now has played an extraordinary role in raising the profile and status of nurses on the global stage. The campaign has pushed countries towards action, developed a new generation of nursing leaders, and increased the influence of nursing in health systems globally. Last year, Nursing Now, WHO, and the International Council of Nurses came together to develop the first State of the World's Nursing Report. The report highlighted significant global shortage of nurses and provided policy options for countries to leverage the full potential of nurses to support the health of their communities. The COVID-19 pandemic has been especially hard on nurses, many of whom have been at the forefront of the crisis for well over a year. Thank you so much for your continued determination and commitment. As the Nursing Now campaign comes to an end, I urge countries to invest in nurses so they are supported, protected, motivated, and equipped to deliver safe care. That includes endorsing the new global strategic directions for nursing and midwifery at the World Health Assembly this week. My special thanks to Lord Nigel Crisp and Professor Sheila Tlaub for the leadership they have shown as co-chairs of the Nursing Now Global Campaign Board. Nursing Now may be ending, but our work to support nurses and countries continues with the same commitment. I encourage countries, healthcare employers, and nurses to engage in the Nightingale Leadership Challenge. We have 2 more years to reach the target of training 100,000 new nurse leaders who will have a positive impact on their communities for many generations to come. Now more than ever, we need the dedication, the skills, and leadership of nurses to deliver care and to deliver a healthier, safer, fairer, and more sustainable future. I thank you.
Thank you so much, Dr. Tedros. Thank you so much for your support for nursing and midwives, as well as for your great efforts at this challenging time all over the world. Thank you so much. Now we will start our next panel session for 27 minutes, and Arwa, the floor is yours.
Okay. Welcome to the second session of our celebration. In this exciting session, we have 8 leaders and young nurses who will share their stories and reflections on how the Nursing Now campaign impacted nursing leadership, advocacy, midwifery, and how it influenced the investments in the young nurses and midwives in selected countries of the Eastern Mediterranean region. I would like to remind all our speakers that we only have 27 minutes, so we really need to be sharp on time, the 3 minutes for each one, and because we will have the clock for each one, and we want to give the chance for everyone to be able to speak. In this session, we have the 8 speakers, including the Secretary General of the Jordanian Nursing Council. I welcome you, Dr. Hani, Dr. Rafat Jan. She's the Dean, Associate Dean for Outreach for Policy in Aga Khan University, Pakistan. And we have and Dr. Mohammed Al Ghamidi, he's the president of the Saudi Nurses Association, and the Director General of Nursing at the Ministry of Health in Saudi Arabia. We also have Dr. Sumaya Al-Blushi. She's the Director of Nursing Department from the Ministry of Health in UAE. We also have welcome Dr. Mirna Dumet. She's the President of the Order of the Nurses in Lebanon. Aisha Al-Mehri, Group Chief Nursing Officer in Abu Dhabi Health Services Company and the President of Emirates Nursing Association. We also have 2 young nurses, one from Egypt and one from Sudan. We're really proud to have you, Ala Al-Kammash, the Egyptian Nurses Student Scientific Association, actually Novice Nurses and Student Scientific Association, and Mr. Hassan Khaled. He's from the Nursing Student Federation from Sudan. Welcome all of you, and I will start with introducing our first speaker, Dr. Hani Nawaf, the Secretary General for the Jordanian Nursing Council. Dr. Hani, the floor is yours.
Hi,
We also have Dr. Sumaya Al-Blushi. She's the Director of Nursing Department from the Ministry of Health in UAE. We also have welcome Dr. Mirna Dumet. She's the President of the Order of the Nurses in Lebanon. Aisha Al-Mehri, Group Chief Nursing Officer in Abu Dhabi Health Services Company.
I'm sorry the voice used to come late, but I will start assuming that this is my term is coming. I will just start. Ladies and gentlemen, first I would like to greet my nurses in Arabic. تحية تقدير واعتزاز للممرضين والكوادر الصحية الأردنية، فأنتم أبطال المرحلة، وجلالة الملك وصاحبة السمو الملكي الأميرة منى الحسين المعظمة فخورين بكم أيها الجيش الأبيض. كما ونتقدم بالتحية والتقدير للتمريض بالإقليم وتحية الفخر والاعتزاز بالكوادر التمريضية والصحية الفلسطينية الأبطال الحقيقيون. Greeting and appreciation to the nurses in Jordan and health professions. You are the heroes of the state. His Majesty King Abdullah and Her Royal Highness Prince Mona Al-Hussein, the President of Jordanian Nursing Council, are very proud of you, the White Army. A greeting also extended to the nurses in the region, and a special greeting to the Palestinian nurses and health professions, the true heroes. Jordanian Nursing Council worked to modernize professional nursing regulation in Jordan and play a key role in development the licensure exam, the specialization through developing scope of practice standards and competency exam, clinical training standards under emergency and COVID-19 pandemic, policy and advocacy letter regarding nursing education and practice, National Simulation Center in progress, national activity under the Nursing Now campaign were carried out in various activities, and leading a national nursing dialogue hand by hand with our partners through nursing managers and nursing dean forum. GNC plan toward the future developing in nursing in Jordan, internship program to bridge the gap between nursing, between education and practice, residency program leading to specialization in nursing. My final message to policymakers in nursing and nursing leaders in the region: continue to modernize professional nursing regulation in Jordan and in the region. Governorates need to invest in a massive quality acceleration of nursing education, creating nursing job and leadership. Finally, let us seize this opportunity to commit to a decade of action that influence policymakers to strengthen nursing and midwifery at a national and regional level, also establishing a solid regulation body and nursing council to further raising the status of nursing and promising future where nurses' voice are heard loud and clear. Thank you very much all, and we need action, we need action. Thank you, and future, good future for nursing.
Thank you, Dr. Hani. Now the floor is yours, Dr. Rafat Jan, the Associate Dean for Outreach Policy Unit at the School of Nursing and Midwifery in Pakistan.
Assalamu alaikum to everyone. I would like to start from giving a very good news that in January 8, 2018, our Pakistan President, Dr. Arif Alvi, actually launched Nursing Now, and Dr. Tedros was also present, and the government promised through like Nursing Now's goal that they are going to invest in the nursing. So the good news is this, my slides are not on, but the good news is this, that Pakistan government invested through Ministry of Education, and they started giving scholarship, which is nursing scholarships, and they did nursing endowment scholarship, and they started giving us 1,000 scholarship for studies because they wanted to bring more nurses, and they are giving for bachelor's, master's, and PhD education. And these nurses will be providing care everywhere because government is also giving sort of insurance for universal healthcare coverage. So these nurses will be posted, nurses, lady health visitors, and midwives, they're all. So they will be posted through primary care center, like basic health unit, to all the way tertiary care. This is a very, very good thing. And the first time government said it's not just the public sector institution, but they are also giving this to private sector institution. So I think this is a very good news for all of us in Pakistan, and we are enjoying these kind of direct investment into nursing education, who will be providing care. With that, the government is also doing lots of training, and they are investing money for pandemic, be it SOPs training, vaccination training. Government is investing, and all the nurses, be it intern or students, they are the front line for the vaccination, which is very good. And finally, I would like to say that the man who was behind in this transformation of nursing in Pakistan was His Highness the Aga Khan, who actually invested a lot in nursing 40 years ago. And Aga Khan University actually started bachelor's and master's and PhD program. Today, whole country, Pakistan, is enjoying with this fruit. So we are very, very grateful to philanthropists, to our partners, to our donors, and to our governments, provincial, federal, districts level. Thank you so much. Thank you for giving me opportunity to present in nursing now. Thanks a lot, Pakistan.
Thank you. Thank you, Rafat. The floor is yours, Ruwaida. Over to you.
Allow me to introduce His Excellency Dr. Mohammed Al Gamidi, the President of the Saudi Nurses Association at Saudi Commission for Health Specialists and Nursing Director General. Also, he is, the Director General of Nursing at the Ministry of Health in Saudi Arabia. Our great director and student also in the past, Your Excellency Dr. Al Gamidi, the floor is yours.
It's a great honor. Thank you so much, Professor Ruwaida. And thanks a lot for the incredible team, for the punctuality, dedication during the last few weeks, which gave this event a great kickoff. I'm very keen today to speak on behalf of the Nursing Now Saudi Arabia and my colleagues, the members of the Saudi Nurses Association. It has been 3 years since Nursing Now campaign was launched in February 2018, with the goals of rising the status of and profile of nursing profession, empowering nurses, improving health and well-being locally and globally. Nursing Now campaign is not just only supporting nurses and their institutions or countries, but just to learn how to strengthen the development of political leadership skills, how to take their right rules in the right place where decisions are being made, and having an active voice in order to drive. As a very efficient social movement, Nursing Now campaign aimed to match global policy actions with the local campaigns. Therefore, Nursing Now campaign had been shared motivational ideas, thoughtful perspectives with our nurses, which had been successfully inspired more than 200,000 nurses in Saudi Arabia, working in Saudi Arabia, to think globally and act locally as a future vision that enriches perspectives, make nurses more innovative, motivated, and effective as practitioners, educators, researchers, managers, leaders, and policymakers. Actually, Nursing Now campaign in Saudi Arabia promoted cross-professional practice, training, and cooperation, including seminars, the role of nurses in the community, advancing nursing practice, and influence through strong leadership. In fact, health policy, power, politics determine the health of populations nationally and globally. They shape the profession, the practice, the work environment, where we spend most of our time, emotions, efforts. Thus, every nurse should develop the skills to be a strong leader, understand how policy impacts every segment of our profession, and have the courage and confidence to make decisions in tough policy arenas. Lastly, the Saudi campaign worked nationally with many cities and regions to ensure that experienced nurses, leaders are there, available anytime to help nurses deliver their potentials. Thank you so much spending away with the time, and thank you for giving the opportunity to attend and celebrate Nursing Now Global footprint event. Thank you so much.
Thank you so much, Your Excellency Dr. Ghamidi, for a very powerful message. And allow me now to introduce Her Excellency Dr. Sumaya El-Blushi, the Director of Nursing Department at the Ministry of Health, United Arab Emirates. And also, I'm so honored to be once upon a time as her advisor. So, Dr. Sumaya, the floor is yours. 3 minutes, please.
Thanks a lot, Dr. Ruwaida. It's a pleasure and an honor to be with you today. Investing in young nurses and midwife, leaders of today and tomorrow. When United Arab Emirates joined the Nursing Now campaign, youth played a major role as a backbone of the campaign, demonstrating great leadership. The campaign has supported the national efforts and collaboration toward enhancing the nursing profession at multiple levels, starting from the community perception, followed by youth call to join the profession, supported by academic development, and ending up by building the leadership capacity of nurses and midwives across the country. During COVID pandemic, our youth nursing leaders were and still provided the opportunities to participate with the organized country response to pandemic and the mass vaccine program, marking outstanding achievements. The launch of National Strategy for Nursing and Midwifery Roadmap to 2025, considered a historical achievement accomplished with great contributions from our youth nurses and midwives. I recall one of youth stating that it was an amazing opportunity to share their challenges and future expectations, which are heard and acknowledged. Investing in their quality and innovative education under national initiatives documented increase in the number of nursing and midwife, increase in the number of nursing students over the last 3 years from 700 students to 3,000 nurses. We have supported the academic partners to launch the first midwifery program in the country and currently looking toward establishing additional nursing specialization programs that meet the national health priorities. At national level, a massive work involves partnership between academic and healthcare service provider is being to reform the nursing education. In United Arab Emirates, we developed and implemented a comprehensive professional model, including the 6 components to provide and support sustainable and standardized accessible development opportunity for our youth. I would like to end by recommending all to invest in youth and their leadership capacity programs as they are the future of our healthcare. UAE leaders believe that youth are the key to country's future success, evidenced by youth councils along with other initiatives under the Federal Youth Authority, inspired with the leaders' belief that youth are the key to country future success. Once more, thanks to all nurses and midwives, and congratulations for successful campaign.
Thank you so much, Your Excellency Dr. Sumaya, for a really powerful message too. Now the floor is yours, Dr. Arwa.
Okay. Now our next speaker is Dr. Mirna Dumet. She's the president of the Order of Nurses in Lebanon. We're really
Arwa,
happy
we
to
cannot
have
hear you.
You can't hear me?
No, now it's fine. Okay.
It's fine. Okay. The next speaker is one of our also leaders in the region, Dr. Mirna Dumet, the president of the Order of the Nurses in Lebanon. Dr. Mirna, the floor is yours.
Thank you. Good day, everyone. Dear colleagues, greetings to all and special tributes to our Lebanese nurses who proved to be the superheroes throughout the past 2.5 years. Their work, their perseverance, and their resiliency has put the profession of nursing on the decision-making table in Lebanon. As Order of Nurses, we were able to advocate for nurses' rights. We were able to shed the light on the work of the nurses. We also worked at the legislative level, and we were able to be present at almost all national health meetings. Of course, we were able to make the nursing profession a voice to lead and a voice to be heard. And we were inspired by the Nursing Now campaign. Despite all the catastrophes that we passed through, from the revolution, the economic crash, and the Beirut blast, we were able to flip the coin, and we were able to make nursing benefit and gain. Despite the pain, despite the danger, despite the suffering, we were able to ensure better visibility for the nursing profession, and we were able to also to ensure a bigger role at the national level. And this bigger role was reflected by the increased number of young people who are applying to nursing schools all over Lebanon. Also, it is reflected by the space that media is giving to nursing nowadays in Lebanon. It is reflected by the respect of the people of Lebanon to all nurses. Whenever they see a nurse, they pay tribute to the nurse. Thank you, Nursing Now campaign, for empowering nurses. And we promise to keep the spirit of Nursing Now as a legacy within the Order of Nurses. Thank you, and happy Nurses Day to all.
Thank you, Mirna. Let's see if we have Aisha. I can't see you, Aisha Al-Mahri. Are you there? Okay, let's move to the next speaker. I'm pleased to really introduce Ala El-Kamash. He's a young leader from the region, and he's from the Egyptian Novice Nurses and Student Scientific Association. Ala, the floor is yours.
أوكي، السلام عليكم. أتوجه بالتحية إلى سمو الأميرة وإلى كل السادة الحضور، وإنه العظيم الشرف بأن نكون من الحاضرين الآن في مثل هذا الحدث الفريد والأول من نوعه، والفخر لي بأن أكون من أبناء المهنة، حيث أنها أكثر المهن التي تتسم بالعطاء والتضحية، وهذه الأيام أكبر مثال على ذلك. أما بعد، فمنذ 12 عام قمنا نحن طلاب التمريض وحديث التخرج في مصر بإطلاق تجربة كانت وما زالت وستظل من أكثر التجارب الملهمة للشباب، ليس فقط في مصر بل على مستوى الشرق الأوسط. إنها إنسا الجمعية المصرية العلمية لطلاب التمريض وحديث التخرج. عملنا سويا على مدار 12 عاما، متحدين ومتحدين صعابا جما من أجل تحقيق رسالة واحدة فقط، وهي إعداد قادة لتمريض المستقبل. وخلال 12 عاما قمنا بمحاولة نقل شباب التمريض من كونهم جزءا من المشكلة إلى جزءا من حل المشكلة، وذلك من خلال إشراكهم في العديد من الأنشطة المحلية والوطنية والدولية. فعلى الصعيد المحلي قمنا بتنظيم مئات حملات التوعية الصحية وبرامج بناء القدرات ومعسكرات التدريب التي تساعد على إعداد قادة من مختلف محافظات مصر. وعلى الصعيد الوطني شاركنا في وضع خطط وبرامج وسياسات صحية وطنية من أجل إثبات أن للتمريض صوت نحو القيادة. وكان لنا دورا متميزا مع وزارة الصحة المصرية لتقليل انتشار فيروس كورونا منذ اندلاع الجائحة في مارس الماضي، وقمنا بتأهيل وتدريب 7500 طالب تمريض وخريج بالتنسيق مع اليونيسف ومنظمة الصحة العالمية، وذلك على ضوء بروتوكول تعاون مشترك مع المجلس القومي للسكان. وأيضا نستعد حاليا لإطلاق أكبر حملة للدعم النفسي للعاملين الصحيين الذين وبلا شك تأثروا خلال الجائحة. أما على الصعيد الدولي فقد شاركنا في العديد من الأنشطة والمحافل الدولية، وأهمها الكونغرس الدولي للمجلس الدولي للتمريض. وأيضا نحن أسسنا المنظمة الدولية لطلاب التمريض وحديث التخرج بأسبانيا، وتأسيس المبادرة الأفريقية لطلاب التمريض وحديث التخرج برواندا. وقمنا بتنظيم عدة زيارات لتبادل الخبرات والمعرفة مع عدة دول مثل الأردن ولبنان والسودان وعمان والسعودية والإمارات. أما خارج المنطقة فكان هناك خبرات مع أمريكا وفرنسا ونيجيريا وكينيا. وسنظل نسعى جاهدين من أجل هذه التجربة لنقلها إلى شتى بقاع الأرض. وفي الختام أود أن أطلب من جميع قيادات التمريض أن يعطوا مزيدا من الجهد لشباب التمريض من أجل إعداد أجيال قادرة على القيادة، وتوجه بطلب لجميع صناع القرار ووضعي السياسات الصحية أن يستثمروا في قطاع التمريض أكثر وأكثر من أجل صحة أفضل للجميع. شكرا.
شكرا علاء. It's my also pleasure to introduce Hassan Abras from Sudan, from the Novice Nurses and Students Scientific Association. Hassan, the floor is yours.
Thank you. Your Royal Highness Princess Mirna Al-Hussein of Jordan, Your Excellencies Dr. Ahmed Al-Mandri, the Bilateral Regional Director for the Eastern Mediterranean, Dr. Annette Kennedy, the ICM President, Lord Nigel Cresp, the co-chair of NNC, fellow panelists, ladies and gentlemen, nurses all over the world. I'm sending this message from Sudan, the land of freedom, peace, and justice, on behalf of the Sudanese Nursing Students Federation, which is non-governmental, non-profit, national independent federal organization that support nursing and midwifery students throughout their journey, as well as represent the voice of those who needed to be heard the most, the voice of the youth nurses and midwives in Sudan. In SNSF together and with our 42,000 of individual members, 64 national offices and representation, we managed to use the vision of Nursing Now campaign to highlight the importance of including nursing and midwifery leaders in the decision-making area. By supporting the capacities of more than 12,000 of nursing and midwifery students and novices, sensitizing them toward issues where nurses and midwives in Sudan are really needed to be heard, which include, but not limited to, sexual and reproductive health care, malaria endemic in Sudan, COVID-19, and the list definitely goes on. During our lifetime of 6 years, SNSF was clearly noticed the difference that has been made by the continuous advocacy and frequent highlight to the nursing and midwives' importance. These advocacies that helped us to call for a definitive action toward the end of FGM practice in Sudan. Our effort in this regard achieved the endorsement of the national law to criminalize FGM practice in Sudan. We also, among others, advocated for the safe workplace for nurses and midwives. Our efforts as well resulted in the National Violence Against Healthcare Providers Law. During the COVID-19 first and second wave, SNSF has been among the first major contributors by supporting the communication system of the national government response plan, providing PPEs as well as publicizing the protection guidelines for practicing staff. The workforce shortage of nurses has remained one of our major areas of interest. We are currently supporting the national process of nursing and midwifery mapping program in Sudan. Nurses' voice has been louder and louder since we joined the NNC, and we are willing to continue our effort to improve the nursing status and profile in Sudan. Finally, I would like to tell you during this momentum that together we can make the difference now. Together we can make the nursing now. Thank you. This was Hassan Khalid.
Thank you, Hassan, and thank you all. I think with this, we come to an end to this panel, and let me take this opportunity to thank all of you, our dear friends and dear nursing leaders. Big, really clap for all of you. Thank you very much for sharing your innovative initiatives, innovative stories, great achievements, and the lessons that you learned throughout the years and from the Nursing Now. And the lessons that you learned to be resilient and to build the leadership of the nurses to overcome all the challenges they face while they are providing the healthcare in the different settings and throughout the changing and challenging circumstances. Thank you all, and we really appreciate your participation. Now we will have a 5-minute video on the Nursing Now achievements and the campaigns over the last 3 years. So join me to watch this short video, and hope to continue the session, the third session later.
Nursing Now has united nurses and their allies and created a mighty movement for change. In the 3 years since Nursing Now was launched, the campaign has led to the creation of more than 700 independent groups in 126 countries, and has seen over 31,000 nurses and midwives participating in the Nightingale Challenge.
Nursing Now has opened huge opportunities by involving me in high-level discussions and meetings with global health partners, including WHO.
Over the last 3 years, I have been involved as part of the board in contributing towards the voice of young nurses.
Working with Nursing Now, I learned the importance of working together, networking, sharing, advocacy, the need of empowering early career nurses, and the importance of working with data in hand.
Definitivamente, Nursing Now nos vino a enseñar la importancia de la enfermería a nivel mundial, pero también la importancia de la necesidad de enfermeros y enfermeras en puestos de liderazgo y su participación política en los sistemas sanitarios.
The Nightingale Challenge has been a really brilliant opportunity to galvanise nurses across the globe.
Through the partnership with Badet Trust for Nursing, we are implementing our Nightingale Challenge project in Uganda, which aims at building resilience of nurses and midwives in provision of adolescent-friendly sexually reproductive health services.
It has been an exciting opportunity in being able to learn about leadership and what goes into global health decision-making.
It is very clear that no country will ever be able to achieve its goal for universal quality healthcare for citizens without investing in their nurses and midwives.
Nurses are vital agents of change who can improve health and transform healthcare. It's time to invest in nursing and enable nurses to work to their full potential. Over the next 2 years, the Nursing Now Challenge will work to reach over 100,000 nurses and midwives, inspiring the next generation of nursing and midwifery leaders across the world. Please join us as we work together to ensure access to health for everyone, everywhere.
Welcome to the closing session of our today's celebration, in which regional and global nursing leaders will deliver global, regional and global nursing leaders will deliver their messages of support and their reflections to sustain the momentum and the legacy of Nursing Now during the Year of the Health and Care Workers 2021 and beyond. We have only 21 minutes and 5 speakers will share this session. I hope that you also stick to 3 minutes sharp. Now we will start with Her Excellency, Dr. Fatima Rifai, who is our ICN regional representative. The floor is yours. She's one, of course, of the great regional as well as national leaders. Dr. Fatima, the floor is yours. Yes, Dr. Fatima? We can't hear you, Dr. Fatima. We can't hear Dr. Fatima.
Maybe you're muted, it seems.
Dr. Fatima, I think you are muted. I think there is problem with the connection of Dr. Fatima. Okay, let's go to our next speaker, Roa, till Dr. Fatima fixes hers. Okay, so our next speaker also is a regional, national, regional and global hero, who is Dr. Rua. We are so proud to introduce Dr. Rua. She's also our ICM region representative at us. Yes, Dr. Rua, the floor is yours. Rua? Rua? Dr. Rua?
Hi, yes.
Is this Dr. Rua?
Go ahead.
Yes, please, go
Yeah.
ahead.
Hello. Good afternoon, everyone. It's my great pleasure to be here today as an ICM board member for the Eastern Mediterranean region and the chairperson of the Saudi Midwifery Group. We recognize at the ICM the importance of global campaigns such as the Nursing Now campaign, particularly with great evidence on how it has been instrumental and successful in highlighting the importance of nurses in responding to emergencies and saving lives everywhere and to all people. This campaign has been impacting the status of nursing and empowering the young generation to feel proud of their contribution to improving the quality of health services to everyone, everywhere. Stakeholders, policymakers responsible for healthcare professionals can learn from the success stories of the Nursing Now campaign and become inspired to develop the established similar initiatives to support members of these professions to excel and pave the way and lead prosperity of their professionals to serve their communities with pride and creativity. Midwives are critical healthcare professionals who are saving the lives of women and children. They are essential provider of primary health care, can play a major role in this area. Midwives play a vital role in reducing the risk of childbirth for women all over the world, but many have themselves been exposed to the risk during COVID-19 pandemic. They deserve the visibility and celebration of their role in making the world a better place for women and children. Follow the data, invest in midwives is the theme of this year's International Day of the Midwife. The data included in the third publication of the State of the World Midwifery Report, by which was launched in 5th of May 2021, show that achieving universal coverage of midwife delivered intervention by 2035 would avert 67% of the maternal deaths, 64% of newborn deaths, and 65% of stillbirth, and would save an estimated 4.3 million lives a year. This report is dedicated to all health workers who have lost their lives to COVID-19. It's more than just a report on the current state of midwifery. SOMI also provides midwife leaders with the evidence they need to support and strengthen regional advocacy efforts. The analysis of this report indicates that fully educated, licensed, and integrated midwives supported by interdisciplinary teams and enabling environments can deliver about 90% of essential sexual, reproductive, maternal, newborn, and adolescent health care intervention, which are essential components of the sustainable development goals. Yet they account for less than 10% of the global health workforce. In many countries, midwives are not authorized to perform tasks typically considered part of the midwife scope of practice. ICMC regional data on the state of midwifery at the core of what makes SOMI functional, with the potential to bring about significant country-level change. Investing in midwives leads to healthier families, more productive communities, and more robust health systems. Thank you.
Thank you so much, Dr. Rua. And I don't know if Dr. Fatma is connected yet. Dr. Fatma? Dr. Fatma?
Yes, I'm here.
Yes, please.
Yes.
Now, our hero, Dr. Fatma, is with us now. Please, the floor is yours.
Thank you very much. I am so grateful, so pleased to be with you celebrating the successful campaign of Nursing Now, and also celebrating moving Nursing Now groups to ICM, I guess. I am really will reflect on some aspect of what's happening here in our region. As you know, that our region is not only affected by COVID challenges, but also
conflicts and economic hardship are quite challenges these days in the region. So to consider some points and to reflect, I think one issue is to look at the shortage pattern in our region. Our region of 23 countries that has 13 national nursing associations that are member of ICN, and nursing now groups are in 13 countries of these 23. And also we are witnessing the emerging of students and young nurses organizations. All these are good structures and pillars to move nursing and midwifery forward in the region. But again, I got to talk about the challenges or the consideration to reflect on. The first one is, I think, very important shortage of nurses in the region. We experienced a severe shortage in some countries and somehow a better situation in other countries. So situation is not the same. We have the lowest nurses and midwives per 10,000 in our region to be 3.2. At the same time, in some countries, we have 73.2 nurses and midwives per 10,000. So you see, the variation is very wide, and to really look at the challenge region-wide, it's quite a challenge. So I think that shortage is caused by two factors. One is that some countries are not able to train their own because of many reasons, and other countries, their nurses are migrating, looking for better packages and better situation for their career. So the shortage is within the region is really also varied. Education, though we see many countries, say some countries have increased number of colleges and schools and have more programs for nursing and midwifery, but there is still quite challenge with low admission in some countries, and some countries have low funding, so low capacity to accommodate the candidates that are available to enter nursing and midwifery. Of course, the lack of faculty is very obvious in the region. In addition to, I guess, in some of our countries, the curriculum is outdated and need to be reviewed. Regulation is another challenge. Where I think that our regulations, many of our countries, are not mature yet to allow nurses and midwives to work to their full potential. And with leadership, we have chief nurses in maybe more than half of the countries in the region. The authority to influence policy varies from one country. So with all these challenges, I think it is an opportunity now that we build on the legacy that Nursing Now and ICN programs and our national associations are doing to move nursing. My message is to our Nursing Now group and our chief nurses and leaders in the country and midwives. Strengthen your national nursing association.
Excuse me, Dr. Fatima, thank you so much.
Introduce innovation strategies, including image building, nurture the young, lead changes in the regulatory framework, and introduce
Fatima?
create recruitment practices that are fair to all of us. Thank
you, Dr. Fatima. Thank you.
Collaboration is key strategy. Thank you.
Thank you.
Thank you so much, Dr. Fatima.
Finished.
Okay, and now I would like to introduce another global, regional, and national leader, Her Excellency Dr. Arwa Weiss. She's the Regional Advisor for Nursing and Midwifery, WHO Regional Office. Dr. Arwa Weiss, the floor is yours. And I'm so proud. Also, once upon a time, she was my student, bright student too. Yes.
Thank you, Ruwaida. Thank you all. You know, this is really very exciting to be part of this great celebration. I think by the end of this, global pandemic, we need to celebrate a little bit with the nurses and midwives and really thank them for all the things that they have done. As the evidence and testimonies we heard today, and those we have really been hearing throughout the pandemic, it showed that there is no doubt if we want a resilient health system that we need to engage and connect with the people and all the organizations and nurses and midwives, really they can do that. And the evidence also shows that nurses and midwives possess the needed practical capacities to respond to the pandemic effectively and efficiently in order to promote the health and the well-being, as well as to address the challenges facing health services and health systems. Dear all, as we celebrate endings, we also celebrate new beginnings. Right after this celebration, we need to start and begin a serious post-COVID-19 discussions in order to address the impact of the COVID-19 on the health system, on the nursing as a profession, on the nurses, on the midwives, and on the health system and the health services, professionally and beyond, and as well as how it really affected the lives and the well-being of all people, and where is the roles of the nurses and midwives in promoting their health and well-being. I'm really hopeful that despite all the difficulties to plan for an uncertain future, that we will be able to seize this opportunity and the momentum provided to us, and to be able to collaboratively work together in sustaining all the efforts invested in strengthening the largest segment of the health and care providers, of the healthcare workforce, the nurses and the midwives, and in charting a new era of healthcare where the nurses and the midwives' expertise, which was not used, the unused talents, can be harnessed at every level and in every setting. So the nurses and the midwives can transform the way the health services are designed, organized, and delivered, emphasizing the health equity and how health is provided to achieve health for all by all. And with this, I really thank you all for this opportunity and congratulations. Thank you. Back to you, Ruwaida.
Okay. Would you like to introduce, or I can introduce Her Excellency Dr. Elizabeth Iro?
Yes,
Also
I will.
our,
Okay, let me, with really great pleasure and honor, introduce our one of the heroes actually, who's really fighting from WHO to really support nursing and midwifery globally. Elizabeth Iro, the WHO chief nurse. The floor is yours.
Thank you
Sorry,
very much,
Ruwaida.
Awa. And thank you also, Ruwaida, for chairing this session today. It's been really fantastic just sitting here and listening to all the stories. Dear Excellencies and colleagues, the Nursing Now campaign has for sure ignited a response from nurses in the Eastern Mediterranean region and all over the world that has prompted efforts to raise the status of nursing and amplifying the importance of their roles and contributions to universal health coverage. Nursing Now is a key partner in the International Year of the Nurse and the Midwife, which further increased the visibility of nurses in a year designed for celebration and positive advocacy. But the spotlight fell on our global nursing workforce for a very different reason indeed. As COVID-19 spread around the world, we faced the greatest challenge our profession has ever seen. Overwhelmed by the pandemic, our communities around the world drew strength and support from our established national and global connections and networks, and nurses were able to share their realities and lessons learned. It has not been easy. The response and actions alongside those of our health and care workers around the world has shown the world the critical role nurses have in healthcare systems. Despite the challenges posed by the pandemic, in 2020, the World Health Organization launched the first ever State of the World Nursing Report, which has informed the Global Strategic Direction for Nursing and Midwifery 2021-2025. Again, Nursing Now is a key partner in the development of these documents. This week, the Nursing Strategic Direction for Nursing and Midwifery will be discussed at the World Health Assembly, where a resolution on nursing and midwifery will be presented. This will be an important consideration for our health ministers. This will be a useful tool for strengthening nursing and midwifery in countries. These documents have provided a roadmap for strengthening nursing and midwifery going forward. It has provided a series of recommendations and policy options to strengthen the nursing and midwifery profession and covers areas of education, employment, leadership, and service delivery. We've heard many make references to this. So investment in nursing leadership, especially government chief nursing and midwifery officers in all countries that is enabled and employed and empowered, will be critical. WHO designated 2021 the International Year of the Health and Care Workers, and its theme to protect, invest together echoes the legacy of the Nursing Now campaign to strengthen nursing for universal health coverage and to continue to elevate the status and voice of nursing in health for all. As Nursing Now takes its next steps, its legacy is one of global connection, solidarity, and strength. It has shown us that we are stronger when we are connected and when we work together. Whilst many problems still exist for nursing and the road ahead remains a bumpy one, there's still little doubt that as we emerge from this global crisis to face the challenges caused by health inequity, we must continue to work together in every country to carry on with the inspiring work of Nursing Now, and also to ensure that nursing is not just for now, but fit for the future. The Nursing Now Challenge and our young nurse lead and midwife leaders is sure to light this next chapter. I thank you.
Thank you. Over to you, Ruwaida.
Thank you so much,
Thank
Your
you.
Excellency, Dr. Elizabeth, for a very inspirational and powerful message. And now we are coming to the end of today's celebration. I really am so honored and happy to invite Her Excellency Dr. Barbara Stilwell, the Nursing Now Global Campaign Executive Director. Dr. Barbara is the mover and shaker of this event with her great team, including the ITT team, who are traveling today virtually, actually, around the world. And they've done a great job, not only now, but for the last 3 years, they're doing a great job, not for this event, but also celebrating, working side by side with every single nurse in the world who are joining the Nursing Now, with all nursing groups. They orchestrated, they have orchestrated the global event for the Nightingale Nursing Challenge. So allow me to introduce Dr. Barbara, our hero for today, and I think for the rest of this important year for the health workforce. Dr. Barbara, the floor is yours.
Thank you so much, Ruwaida, and Dr. Arwa too, for hosting this meeting that's been so full of wonderful news about what's been happening in nursing in your region. It's been so inspiring to hear all of these stories, and it really has illustrated that Nursing Now is not one story, it's thousands and thousands of stories from around the world. And it's been my pleasure and my great privilege to be the team leader for this work and to help to gather these stories together so that we can all share and hear them. It's been an absolute honor to be able to do that and to work with you to bring today to the screen, which has been fantastic. I want to pay special tribute to Her Royal Highness Princess Mirna. Princess Mirna is a huge inspiration to nurses everywhere, an amazing champion, both of nursing now, but of nurses through the world and through the ages. And since I've been at WHO, Princess Mirna has been championing nursing. And today she said, applause without action is no longer acceptable. And that is a phrase that we all need to learn and keep close to our hearts. Applause without action is no longer acceptable. And I want to relate that to the strategic directions on nursing and midwifery, because what they will call for, what they call for in the debate that we will have, that Elizabeth Ero has mentioned, they will call for action. And we need to bring our power together for that action to happen. We have shown, as Elizabeth said, we're stronger when we're connected. We really do become a powerhouse for change when we speak with one voice, when we can share not only the challenges that we have, but also how we overcome them, what the innovations are, what the good evidence is. And that's how we get our own inspiration, our own motivation to do a better job all the time. And we've seen that in the Nursing Now campaign. Nurses have really become agents for change in the systems where they are through the most dreadful of years, more dreadful than any of us could ever have imagined. And nurses have stepped up. They've stepped up together. They've shared what they've done to survive, to flourish, to get over all the challenges that have been thrown at them. And that's one of the things Nursing Now has provided, is a platform for that to happen through the groups and through the Nightingale Challenge. The panel presentations today have really shown the richness of the experience in the Eastern Mediterranean region. And we've had and will have panel sessions on all of our regional presentations. Imagine all of these things that have gone on around the world that we're able to share. It's absolutely amazing. And I think one of the effects of the pandemic is really to make nursing now even more global, because everything we've done, we've been able to open up to the world. And isn't that wonderful? And for some of us who are older, like me, we've really seen the benefit of the internet. In fact, I've been talking with some of my older colleagues recently about how we cannot imagine life without the internet now. You know, how are we connected in this amazing way around the world? And when Sumaya was doing her presentation, she said, youth are the key to the country's future success. And I do believe that is true. So inspiring to hear from young nurses in your region, from Sudan and from Sumaya, about what the work they've been doing, what they've achieved. It's absolutely wonderful, so inspiring. And you are right, Sumaya, the world will not succeed unless we harness the power and potential of young nurses, as you are doing in your region. Annette Kennedy said, the world can no longer afford not to invest in nursing. And that is the truth. Nursing is a best buy in healthcare. Nurses are efficient. They have they have a solid educational background that means they have many skills to promote health, to look after people who are sick, to provide care right into the end of life. Without nurses, there can be no healthcare for people everywhere. We're that important. So what we need to do is to continue this energy, this strength, this connectedness to make sure that we're right there with ICM, with WHO, as they continue to advocate for nurses around the world. We are so ready for this, so ready. So I thank you all so very much for joining us. I thank all our speakers for giving us the honor of your presence today. And I thank Rueda and Awa again for working with us so collaboratively to put together this amazing regional session. And with that, I thank you and I close the session for the Eastern Mediterranean. Thank you so much.